Hello and welcome. We cannot underestimate the impact that weight bias and stigma have on health outcomes for people in larger bodies. Regular experiences of weight stigma can lead to serious health consequences, including disordered eating, elevated blood pressure, anxiety, and has even been shown to increase mortality. This is why it is so important to use person-first language and to create spaces that are inclusive for all patients. The language we use matters. Insensitive terms around obesity perpetuate bias and stigma, impacting not only how our patients feel, but also their level of engagement with healthcare. This leads to delayed care and worsening health outcomes. To address this, we should use person-first language and create spaces that are inclusive for people of all sizes and abilities. Person-first language is widely accepted and should be the standard when addressing people with a disease, rather than labeling them by their disease or ailment. For example, we would say a person with diabetes rather than a diabetic person, and a person with a disability, not a disabled person. Similarly, we should say a person with obesity rather than an obese person. We should also be mindful to avoid using highly stigmatized language and avoid terms like morbidly obese. Creating body-inclusive spaces is also important. Consider how larger-bodied patients perceive our clinics. Are our staff trained to interact with people of all sizes using sensitive language? Is there comfortable seating available without singling anyone out? Are scales and equipments easily accessible and protect the privacy of our patients? Do clinic beds and scales and medical equipment accommodate people of all sizes? Are the images and the reading material in our space inclusive and free from stigma? Imagery matters. We want to avoid displaying images that reinforce negative stereotypes. If our spaces have visuals and reading material, ensure that they include people of various sizes, races, genders, and abilities. Positive and diverse imagery can send a powerful message of inclusivity and acceptance. By reflecting on our practices and our clinical environments, we can identify opportunities for small but impactful changes. Using person-first language and fostering inclusive spaces can help reduce weight bias and stigma, leading to significantly improved healthcare experiences and outcomes for people with higher weight. For more information on using person-first language and creating size-inclusive spaces, please visit Obesity Canada.